Fox 9 on your side at 9 starts now.
A health insurance company is cutting ties with St. Luke's, terminating its Medicare coverage plan. And a lot of viewers wonder if they now have to change doctors. Reporter Fink joins us live to explain how this change could affect you in tonight's big story.
Roland St. Luke says the hospital and Humana couldn't come to terms on an agreement under the company's Medicare plan, thus leading to some very different health options for some of our oldest and most at-risk members of our community.
I'm kind of in shock of what's going on, but I don't want to change.
Medicare patient Carl Wanacott takes a handful of medications daily for a brain tumor, congestive heart failure, and diabetes. Thursday, he got a letter in the mail saying his Medicare coverage plan under Humana would no longer be accepted by doctors at St. Luke's. According to the letter, Carl's coverage would expire January 1st, 2014, with no explanation of how to get other insurance.
I'm not sure if that's part of the Obama program. I don't have a clue because I don't have any paperwork. Nothing is there. Humana hasn't called, said anything to me.
And Humana never called us back when we asked for an interview. That said, Carl, this change did not come about because of Obamacare.
Humana wanted to renegotiate a contract at a lower reimbursement rate that we financially couldn't accept. If you do have a plan that St. Luke's doesn't accept, you're free to look at other plans that are accepted by St. Luke's and make that switch, and then you'd be able to keep your St. Luke's doctor.
Carl wants desperately to stay with his St. Luke's doctor, who he's gone to for almost 20 years. But after researching other Medicare plans, staying with St. Luke's could force this Nampa man to pay a much higher deductible.
What am I going to do next? We're talking more than $2,000 and stuff, and that's a really hardship when you're on a set income.
And there is an open enrollment period for Medicare plans covered through St. Luke's from now until December 15th. If you're with Humana and you or someone you know may be affected by this change, just visit the link we posted on our website, IdahoOnYourSide.com, for more information. Live tonight, Fink, Fox 9 on your side.
A former candidate for the state legislature has found himself the target of ridicule from both parties after his stance on government programs didn't match up with his use of the same programs. Greg Collett ran for the seat formerly held by John McGee and is considered running for office again. Now, he campaigned on ending government programs like welfare and Medicaid, but he admitted that several members of his family are on Medicaid.
I don't think that participating in a program necessarily means that you support it. Those two things can be separated. You can participate in things and not support them, and support things and not participate in them. And that's the way that I look at the issue.
Collett is raising 10 children, some from foster homes or adoption. He's received thousands of emails and phone calls, and he admits that the publicity is getting his message out there, but could harm his political aspirations.